So, okay, my name is Lindsey Moseby, and I am an Executive Strategy Director at Frog Design. My focus is in the healthcare area. I have a lot of background, or a lot of industries in my background, but healthcare is the one that I sort of fell in love with a little over a decade ago. I am the product of a couple of hippies, and so I think it got burned into my psyche really early that you have to do something that means something, right? You got to do work that matters. So I had a real hard time working for my AT&T clients or my Coca-Cola clients or whoever they were, and was always looking for silver linings. And it's not that that's a bad thing by any stretch of the imagination, but I really like doing work that has impact. I like doing things that make you feel like somebody's going to benefit at the end of the day. So I work for a company called Frog, which is a funny name. I understand maybe it stands for Federal Republic of Germany because our founder was a German designer, or who knows. But anyway, he started our company about 43 years ago. Our claim to fame was that Steve Jobs asked him very early on to come over, start an office in the San Francisco area and help him work on the original, excuse me, I have allergies, so y'all pardon my clear my throat. I can imagine I'm in good company here in Texas, yeah. Yeah, he went over to San Francisco to help Steve Jobs build the first sort of design language for the Macintoshes. So a very auspicious start, obviously, for our company. And we do a lot of things now. We definitely still do product design, but as we'll talk about here in a minute, there's a lot of room for what product means these days, right? Products are no longer just kind of the things that we hold. Products are very much, they're very experiential. They may be virtual, they may be sensory. They're not always just that thing. And what my company does is try and figure out how to design products and services that really kind of get to the heart of what human beings need, right? What is it that people need to do? And that's not always healthcare, but we do automotive and telecommunications and all that kind of good stuff. But for us, we do lots of work in the wearables arena. We do medical device design. We do tons and tons of virtual engagement with apps, all that kind of good stuff. So it's a lot of fun. And it gives me kind of maybe a different purview on what healthcare is these days. I think that clearly healthcare is in the middle of an absolute sea change, right? Like for us in the United States, there's a lot going on and it's very contentious. There's a lot of heated debate on both sides. For me, I kind of like to think that doing something is better than not doing anything at all. So at least we are trying to move the needle. We'll get there, hopefully. It's certainly not perfect, but there's some arenas that are opening up where technology is concerned that's actually really, really interesting, and I wanted to talk with you guys about those today. So the first thing I wanted to say is that whenever I start talking about healthcare, or whenever I'm with healthcare people, everybody says we are, I'm looking in front of that, I'm sorry. Sorry, I have to get in front of the camera. Everybody starts talking about patients. Okay, yes, we are patients at times, but we are people first, right? We don't come to healthcare as patients. We come to healthcare as people with rich lives, with a lot going on besides just what's wrong with us at that given point in time. So I really like to have people stay focused on the fact that we're people, not just patients. And the really interesting thing about that too is that we are, because of the way we live these days, because of the way the rest of our lives are, or at least those of us who, US and sort of, of enough means, we bring a lot to what we expect these days, right? So we have a lot of affordances, and they just continue to grow where technology is concerned, where our communication is concerned, where our purchasing power, our choices. It's huge. We have tons and tons and tons and tons of options. So we are patients with a whole lot less patience, so to speak. We are very, very mobile and very, very motivated. We are very tuned into transparency and accountability in a way that's maybe shifting back to the way it used to be, but we are starting to ask a lot more of the companies that we do business with and that we give our money to. We want to know where that's going. We want to know who they are giving that money to, what they are putting into our products. We are, again, that sense of accountability is coming back really loud and clear. We are also increasingly capable, right? So maybe back to the talk we just heard, for a long time we've sort of thought seniors are not going to be able to figure out how to use technology, so we're not going to be able to use that stuff with them. I beg your pardon. They are a lot more technologically savvy than we are giving people credit for. Certainly if we're in our upper years, the older, it's harder. But if you look at sort of the statistics of the baby boomer population, and even those who are kind of getting up into the more senior years of that, there's a lot of technology adoption. People are using iPads or tablets. There's familiarity with FaceTime or Skype and being able to sort of talk back and forth. That's a very, very powerful tool. Those communication outlets are incredibly important tools. And for us to think that some of the older set are not going to get it is just not the truth. So when I talk to people about healthcare, I can't help but sort of go to something like, this is what we think of, right? When we think of healthcare, we sort of think of it's insanely expensive. I don't know how to navigate it. I'm going to be sitting in the waiting room for however long, right? We are very, very used to a very bad experience more often than not with healthcare. But it's also in the context of the rest of our lives where we really expect this, right? We don't expect to sit in line anymore or to sit for hours anymore. We expect ease. We expect that transparency. We expect immediacy. We think things should sort of just happen, especially if you look at the 30-somethings, the millennials who are digital natives, and they've been holding that phone since the day they could grip it, basically. So if you think about how we bring ourselves to healthcare, we bring all of this input. We bring what we expect in every other facet of our lives to healthcare. And yet somehow healthcare haven't quite figured out how to do this part yet, right? Like our hospitals are still using like restaurant beepers, which just kills me, right? Like the little things that light up when your table is ready, that's what you get at the emergency room at some hospitals. It's like, what? How is that possible? But that's kind of where we are, which I also think is an irony because healthcare is one of the most innovative industries ever. What we can do with the human body, what surgeons can do, the machines and the devices that we are using are absolutely incredibly innovative. But yet the healthcare process, the healthcare's adoption of these newer technologies is it's about the same as law profession, evidently. So what I wanted to talk with you guys a little bit about was how the interesting point about healthcare is in any other industry where we're participating, it's probably because we want something, right? Like we want to go buy a new thing, or we want this, take a trip, whatever it is, right? We come as consumers to buy things that we want. Nobody wants to be a part of healthcare. We don't want to be customers of the healthcare system, right? Like this is not a fun place to spend our money more often than not. At the same time, we know there's some really, really broken parts of not only the system itself, but of how we even take care of ourselves, right? How we even sort of participate in our own care. We know that about 50% of the total costs in healthcare, so if you think about the $1 bajillion that are being spent in healthcare today, 5% of the patients are actually eating up that 50%, over 50% of it. Most of it is due to chronic disease issues. Most people who suffer from a chronic disease suffer from more than one. So on average, a person with a chronic disease is going to see a doctor or be admitted to a hospital 41 times a year versus just 6 for sort of the average person. Getting into the hospital is the most expensive thing we spend on. It is the most expensive place to get care. It is the most expensive place to deliver it. One of the things that I loved about the conversation that we just heard, or the talk we just heard, was how do we help the caregiver, right? Those are the people, if you can keep people home longer, it's a much slower disease progression for many types of diseases because home is familiar, they know that space. Again, you're not going into a place where they're going to charge you $257 for an Advil. We know that it's cheaper to stay at home. And we know that healthcare reform is happening, right? Like whether we agree with it politically or not, it is happening, and we are having to figure out what the new ways are going to be for how we do what we do in the healthcare system. So it's forcing some really, really interesting conversations to the top of the table. We're in the middle of an innovation explosion right now, right? There is so much going on. Everything from the way we have Kickstarter and Indiegogo, where people are starting up brand new businesses with absolutely no overhead, to phones that can connect, everywhere and at all times. There's an amazing amount of opportunity where technology is concerned. And I think one of the things that I wanted to share with you guys were about 5 or 6 trends that are out there right now, that if we could figure out how to get them into the conversation, how to start using them in ways that are not just about entertainment or not just about interest, and start using them in a health fashion, what might it mean for the way that we not only take accountability for our own health and the health of our families, but also how might it help change the system that we're actually trying to fix as we speak. So one of them, I'm just going to go through about 6 of them, and then I'm hoping to have a few minutes left at the end so that we can talk and y'all can ask me questions if you're interested. This right here is a thing called telespec. It is a teeny tiny mass spectrometer. It's not working yet. It's a prototype of something that a couple of people have started. That thing, if you point it at your plate, the end state is that it will tell you everything that is in that food. So it will tell you the calories, it will tell you the fat content, it will tell you the proteins, it will tell you the carbohydrates. It will literally read for you every single part of what's in that. It's not there yet, but this is what people are dreaming up, right? Like this is going to be something that we can analyze our diets in real time all the time. So clearly, for those of us who are trying to, watch what we eat and watch what we consume, not only from a caloric standpoint, but gluten. Think about all the impact on being able to see where allergens are. Think about diabetes, right? To know what sugars and what your carbohydrates are. How might we be able to shift our health and our conversation around food when we can analyze our diet in real time all the time? Another big thing that's going on, I don't know, who here wears a Fitbit or a Jawbone or something like that? Oh, yes, exactly, me too. I've been wearing one now for almost 2 years actually, and I'm still kind of addicted to it. There's something, I'm also sort of OCD, so it probably makes sense that I would be addicted to it. But I think it's really, really interesting. For a long time, if you had said, I want to wear something on my wrist that is following me around all day, that's telling me whether I'm sleeping well or not, that do I want to be, that's literally connected to something else and can figure out where I am, most of us would have been like, you gotta be kidding me. I'm not doing that, no way. It's changing. Our sense of privacy, our sense of willingness to be connected is really, really shifting, and it's an incredibly interesting thing. So for us, like tracking and monitoring our health, really, really interesting. I love knowing how many steps I've done all day because I sit at a computer all day long. And if I look down and realize, oh, cool, 3,000 whole steps today, I know that I've moved like less than a mile for the whole day, right? So it's a motivator. Think about what happens if we were able to use these for, well, let me rephrase that. One of my really good girlfriends bought one of these for her mom, who was getting older, because she wanted to know if her mom was moving. She wanted to know if her mom was moving around. And so she was like, here, take this, I've got one, you've got one, we can link up. That way we've got something to check in on each other about. And she was able to sort of keep track, right? It becomes a health monitor for her mom, because she was able to sort of keep, because our tribes don't live together as much as we used to, right? Like we're all over the place. So I loved how she was hacking what this device was originally intended for and turning it into something that actually gave her a connection. It's a communications tool. Another one that's really, really interesting that's starting to happen, what happens when our sensors and wearables, I don't know if you guys would be familiar with the term the Internet of Things. There's a lot of really, really cool stuff coming out that's tiny, right? Everything from nanobots that can literally help. These are little teeny tiny microscopes that can be put into the body during surgery for a surgeon to be able to see all the way down to the very, very basic level. This piece right here is a little teeny tiny sensor on a contact lens that detects the glucose levels for a diabetic. So if you have diabetes, you have to poke your finger, or you have to poke your child's finger or heel 8 to 11 times a day. You have to stick yourself with a needle 8 to 11 times per day. What if we are able to do something like this? What if just by checking the mucus or the fluid in your eye, we are able to read that glucose monitor and we take that part away, right? People don't have to stick themselves. Moms are not going up at 3 o'clock in the morning every single night to test their 2 or 3 year olds' diabetes, their AC1 levels. This is really, really interesting to me. I think this is really fascinating. It doesn't come with a lot of, it doesn't have a lack of controversy around it, obviously, right? Like, people are still trying to figure out what's the right amount of embeddedness or connectivity to all of these things. I'm an eternal optimist, so I like to think that we will figure out how to use these things for good, and then we will figure out how to ward off the bad, but I would hate for us to not figure out how to use these things in ways that could be really, really beneficial for us. Another one that's really interesting is what happens when being there isn't a big deal. What happens when this telemedicine and this idea of telehealth really takes off? Scanadu is actually out there. This is a product that got funded through an Indiegogo fundraiser. And the guy that invented it basically created this little machine. You hold it to your temple, and it will check all of your vitals. It'll do all your vitals. So it'll do your heart rate, it'll do your SpO2 levels, it will give you all just the basics, right? It's nothing crazy, but it's vitals. Instead of going to the doctor to get your vitals taken, what if you're a chronic care patient and you have to go into the doctor multiple times a week even? And really all they're doing is kind of doing a quick check-in, right? They're just checking to see if your vitals are basically the same. Well, this thing's wireless. So it just beams that back to your doctor, and you no longer have to go into the you no longer have to go into the doctor's office. Think of all the other little parts and pieces that are hooked to that. It's not just the going to the doctor's office, it's who takes you to the doctor's office. Or do you drive yourself? Or do you have to find the bus? All of these things are part of the ecosystem of care that we're trying to figure out. And it's not just as easy as, as somebody jumping in the car and going to the doctor. This one's also really wonderful. What happens when our environments are sort of optimized to care for us? Not only can we do smart things on our bodies with a Fitbit or something like that, things like Nest, Nest, the thermostat group, yeah. So not only can that let you control your temperature from vacation, right, at your house, which is great, that's wonderful. There's energy conservation, there's all sorts of really wonderful things about that. But what about when we start infusing things like this with air purity? Sensing, right? What happens when we actually connect it to things that help us with allergens? What happens when we start using sensors throughout the home that you can literally, light can be used as a sensor in the wall to detect falls? What about, there's all of these other things that we could be doing and that are available. Now, the technology is there. We just have to start telling people to do it. We need to start telling companies this is what we want, right? The technology is already there for us. Smart homes will allow us, again, on that healthcare front, to be much more able to stay home longer. The home healthcare movement is also just exploding, and I have a lot of hope for how that's gonna, for the people that will join that workforce and be able to be the caregivers that bring that home. There's now who knows Uber? You guys familiar with Uber, the new taxi company? So there's now a service they're piloting in, I think it's New York, where it's Uber for doctor visits. So you can call up a doc that's in that group, and they will come to your house calls. They go back to house calls. So you hit, you call, or you download the app. You say you need somebody. That doctor will call you, assess what's going on over the phone, figure out whether or not they need to come to your house. If they come to your house, it's a flat fee. It's not cheap yet, but it's a flat fee. I think it's $199, something like that. It is reimbursable, so you can then bill your insurance company, but you never leave your house. You don't go to the hospital. That sort of stuff, that, those are things that are going to really shift the way, not only how much care costs, but our understanding and our sort of participation in the conversation. One more, this one's really interesting to me. There's been a lot of talk about genetics and being able to sort of, see our own DNA, and there's Ancestry.com and all these really, really interesting new companies that are sort of advertising, figure out your heritage, all that kind of good stuff. And that is actually incredibly interesting. And from a health standpoint, knowing your own DNA is pretty incredible, right? Young parents are starting to think about whether or not they want to do DNA testing so that they can sort of see whether or not there's things that they should be worried about or that they should be alerted to before they start having kids. That's also not without controversy, but it's there. The other thing, though, that I actually think is more interesting than the genetic piece of it is the microbiome. So our microbiome is actually it's the flora and fauna in our gut, right? Like it's what we eat, what we breathe, what we interact with every day. That's what changes on a regular basis. Our DNA is sort of like it's the blueprint, right? It is what it is and it doesn't change. The microbiome is actually something that is affected by everything that is around us. You can now send in a sample, so to speak, and to this company called uBiome, and they will check everything. They will go through and do testing on the flora and fauna in your gut and help you figure out what your issues are, right? So if it's allergies, if you're chronically sick and you can't figure out what's going on, they will actually be able to do that check. If we can sort of move this into care, it's a little more Eastern medicine-y, but if we can bring some of this into care, it's a much more holistic and well-rounded picture of how we are on a regular basis. So I just got my warning, which is great, because that's okay, we're on the last page. I guess I would leave you with, I hope that I've given you some interesting things to sort of noodle on. And for me, what it's about is, what could we do? What could we bring about if we were really, really activated as consumers of care and not just patients? And what's going to happen when the system is actually truly innovated, when it starts picking up on all of these things that we are doing in the fun parts of our lives and starts applying them to a measure that would actually change people's lives. And that's it.
Any questions for Lindsey?
Yeah, any questions? Sorry. I tried to stay on time. Any questions? One there? Yes?
Oh, I was just going to ask you, as funders then, like what should we be looking for to fund that's going to move the needle in a way that really is impactful for the people in our community?
I think so. Well, Austin's actually a great arena. I would love to see your energy and resources looking at the not so usual suspects, right? So places like Indiegogo and Kickstarter are amazing places to look for young talent that's doing incredible stuff that they haven't gotten a grant for. I think looking at what Seton is doing with the new teaching hospital, they're bringing in a lot of really, really interesting young biotech groups. The new medical school at UT is also going to be an incredibly important part of Austin sort of shifting from a tier 2 to a tier 1 healthcare site. Look at wellness before you look at illness, right? So look at the fitness side of this. Look at the diet side of this. Look at the communications side of this. I really think that sensing and wearables is going to be an incredibly important part of this because it puts the onus back on us, right? Which is really where it should be. We need to be, I don't want to go to the doctor anymore and have him not want or her not want to hand me my chart. That's my chart. That's my chart. I need to see what's in it. I need to know what's in it so that I can take better care of me. And that digital communication piece is going to be an incredibly important part of it. They might not be on your radar yet. I'm happy to help seek them out.
Thank you, Lindsey.
Okay, thank you all.
I have two closing comments for today.